everyone. My name is Makobu Kimani. I'm from Kenya. I specifically live in the coast, Kilifi, which is a little town about 50, 60 kilometers north of the larger town of Mombasa. So little idyllic resort town, but there's a huge research institute there known as the Wellcome Trust research program, and that's where I have been for the last 4 years. I'm a medical doctor by training with further training in public health, and I came to the Wellcome Trust in 2017 to do my PhD, which I have since submitted, awaiting defense. So I registered for this course almost by chance. So we have a training department that shares opportunities whenever they arise, and this opportunity arose, and it was in the midst of the COVID pandemic. We were all getting used to this situation where we're working from home and doing it. So I thought to myself, it wouldn't hurt to do something that takes my mind off my PhD, at least for a week. So it was, I was not really sure what I was getting into at the point at which I registered for the course. However, my research is very much linked to at a point where I would interact with policy development at some point. So maybe by way of introduction, what work I do, my PhD work was centering around pre-exposure prophylaxis programming, specifically in key populations, including men that have sex with men and transgender women. So by what I was looking at is how to better program for this very, very new key populations, if you'd say that, in sub-Saharan Africa. They're not very recognized. So how do we better run PrEP programs for them? How do we make PrEP availability better? And that's basically what my study was about. So my research showed that there are no programming guidelines for these populations, and so there is a need to speak to the Ministry of Health to develop programs for these individuals who would most benefit from a well-run PrEP program. So the policy training, the one-to-one program I did, just introduced me to how do you even begin to approach these stakeholders? How do you even get them interested in what your research? How do you make them begin to imagine how this would benefit the bigger public health programs in the country? So that was the biggest thing that I picked out of the 1 week workshop that we did, where how do you get especially the high power, high interest stakeholders to get interested in what you're trying to do. Subsequent to that, I was assigned a mentor. So Paul Kawale, we've been in contact. We haven't, and this is mainly attributed to me, we haven't moved too far along, and the reason is it also came at a point when I was getting ready to submit my thesis, and so it became January and February were a really busy period for me. I have since done my submission. I'm awaiting defense, so I haven't moved with as much speed as I would have wanted to in terms of engaging, especially the Ministry of Health, and just getting them interested in the results of what we were doing. So that's kind of what I would like to pick up on moving forward now that I have less on my plate at this point in time. I'd like to come up with a strategy for how to engage the national AIDS control programs, the managers of those programs, to just tell them there's this population that really is very under-programmed, that does need some attention, and programming for having a well-run PrEP program would have an impact on HIV incidence in this country. So that is the mentorship that I have been having with Paul, in how to just develop this strategy, and that's moving on well. And finally, since the workshop last year ended, there have been plans to have a series of webinars. So about 2 weeks ago, we had the first webinar, which was mainly just looking, which was very appropriate actually. It was looking at how to develop strategies, how to engage with the right, how to identify stakeholders, how to identify them by their power bases, by what's really important to them, how to get them interested in what you're trying to do. And so that was the first webinar. It was really important, and there was assignments that we did prior to that, and then you see where you probably went wrong in the assignment that you may have submitted. A second webinar is planned for later this month, I think 19th, which is next week. And that one is going to be really interesting as well, because it speaks to use of social media in policy development and getting people interested. So that's really appropriate, because we are living in a period when social media is probably taking over a lot of mainstream, a lot of people get a lot of the information, a lot of their news comes from social media. And so it does make sense that we should use social media to create interest in matters that we think either policy or even policy briefs about should be developed. So in a nutshell, that's what I would like to speak about the entire process, right from the workshop to the current situation where we're doing a series of webinars. Thank you.